Well, hello everyone. I'm Dan Gibson. I'm the mayor of Natchez, and we welcome you to this installment of COVIDCurrent. This is a program that we are doing here in Natchez Adams County, and it is for the purpose of getting information out. And so, in addition to us here, we have a number of people on the phone. And we are going to be sharing important information about COVID-19. We have been doing this on a weekly basis for the last several weeks via conference call, and we decided today to do it via video so that we can have a better presence on social media and hopefully get some good information out there. We will introduce some guests that we have on the speakerphone in just a moment. We also have members of the media participating on speakerphone, and they will ask questions at the end. But I want to first of all introduce our host today. We're at Merit Health, and Merit Natchez is very grateful to have as its CEO, Mr. Lance Boyd. And so, Mr. Lance Boyd, we are grateful to you for having us here today. We also have with us Mr. Robert Bradford. Brad Bradford, as some of you know him, Mr. Bradford is the director of EOC, and under the state organization you have MEMA at the state level, and then on the county level our EOCs. And we in the city and also in the county have been working with Mr. Bradford and looking to EOC for great leadership during this pandemic. And we also want to say President Ricky Gray, I saw him this morning. He couldn't be here in person, but we have been working very closely. And President Gray, you may be on the call. Are you on the call?
Yes, I am, Mayor.
Thank you. Well, we do have the Honorable Ricky Gray, President of the Adams County Board of Supervisors, on the call. So what we're going to do is we're going to first have Mr. Bradford, on behalf of EOC, provide a report because he's literally been following this on a daily and hourly basis since the beginning. And then we will hear from also Mr. Boyd. I have a brief report, and President Gray will, and then we will introduce our guests. So, Mr. Bradford, thank you.
Thank you, Mayor. Thank you, Lance, for inviting us to your facilities and stuff like that. And Mayor, great thing you said about us working together, because there's a term that we use in emergency management. It's called whole community. And what the whole community is that whatever the emergency or pandemic is affects us all, regardless of skin color, where you live, and stuff like that. And we have to go through this together. And, you know, I'm just truly honored to be working with you and Lance and try to get on the right course to get back to normalcy, because a lot of anxiety is out there. We've been going through this for 6 months. It also made us some Facebook doctors and stuff, pretty much, because we've been dealing with this stuff. And I don't like dealing with medical stuff. I just want the emergency side. But with the emergency management side, they have tested a lot of emergency management because we have a lot to deal with. Lance can tell you, trying to get supplies in and, manage all that and stuff like that. Because everybody needs PPE, hand sanitizer and stuff like that. So from the start, my office had a lot of great volunteers and, working with the city now and getting a lot of things pushed forward and being on one accord. Because during a pandemic and emergency, putting out the right information at the right time, making sure that people understand that we're all going through it, so the decisions that, we make as leaders also affects us. A lot of times people may look at, well, why we got the mask mandate? I have to wear a mask too. I don't like wearing it, but we have to do it as leaders because that's what leaders do. And with that being said, we're looking at our numbers. From the time we started, we know our numbers have went up and went down. And it's almost to the point where the information that I get, with the HIPAA and stuff like that, and being from a county that you're in, and you get those reports, you kind of know who has it and stuff like that, and we don't reveal a lot of that. It's up to the individual. But one thing we do know that we can be a resilient community if we just follow the guidelines. And I know Lance can tell you that wearing a mask works. You know, a lot of times people get caught around the numbers and stuff like that, but numbers are numbers. But if we do the small things, started at the lowest level, you know, like they taught us in the military, it starts at the lowest level with the individual. If one individual wear a mask and make sure everybody else wear a mask and social distance, we can keep the hospitals open. You know, by the time they get to the hospital, that means that individual may have came in contact with maybe 15 other people that may have had it and don't know it. So what we're doing at EOC now, Mayor, you know, along with you and your campaign, is getting the message out.
That's right.
You know, we need it at the lowest level to these communities that are not wearing masks and stuff like that. We see these individuals catching COVID, and they're becoming spreaders of it, and they might not know they have it. You know, so we trying to teach everybody that you wear a mask because you're not only protecting yourself, you're protecting the person that around you and stuff like that. And Lance he can pretty much speak and see when these numbers come in, these people come in, you know, some are worse than others. But, you know, you want to be able to help everybody. You know, so the EOC, Mayor, we have put a campaign out along with you, working with you to try to mitigate some of these cases that we're getting. You know, right now, I think we're probably at 900 in some cases. The state provides that with. What we're tracking down the counties, we're at 85. That's confirmed active cases. And sometimes we do go down, and a lot of those cases come out because they're quarantine dates. So we kind of follow those and see where they're at on these and stuff like that. What we're noticing is a lot of households, different individuals are catching it because they can't social distance. So what we're doing, we're looking at that, and I know we've talked about it, is having COVID-19 shelters where people that can't social distance or get their own bathroom to be able to come there for their 14 days, where they can isolate, where they won't contaminate their family members. And you know, you look at Natchez, we do have a high poverty rate. And according to when we get our numbers back, a lot of these apartment complexes, when we see the numbers inside those apartment complexes, we kind of can know, hey, we know they can't social distance because we've gotten this addressed 3 or 4 times. So we're knowing it's like they're somebody in that place or that residence is continuing to spread it, and they're not doing it. So we're trying to, you know, mitigate that way. That's why we're doing the masks, handouts, and we do things like that to try to get people to understand that wearing a mask, social distance, washing hands, it helps. You know, are we going to get away from having a case? We don't know. Nobody knows the future, but what we can do, we can plan at the lowest level, and that's what, you know, the commitment of the EOC with the combined everybody that's a part of EOC to work together as a team, because we have a lot of subject matter experts, but when you bring those experts into one area, we can solve the problem. And it's kind of what you're doing today, bringing everybody in so we can understand, we can see what the problem is. And I don't have all the solutions, but that's why you align yourself with great people, because somebody may have the answer. You know, they can say, hey, let's try it this way, and we can do it, and we may reach them there. So, you know, like I say, we're just doing a great job in the EOC, trying to get the information out and working with the public and trying to get everything out much as we can at a timely fashion. So, like I said, I want to commemorate you and President Gray for y'all relationship in bringing everything under one umbrella and moving forward. So I commend you with that.
Thank you, Mr. Bradford. Thank you. We appreciate all you're doing. We have also Lance Boyd. Why don't you give us a report here from Merit Health?
Be glad to, and thank you. You know, last week was kind of a rough week, as we reported, and we did have a couple of deaths. But since that time period, the last 7 days have really been much better. We've actually seen numbers of hospitalized patients drop down. Just got a report before I came in. We're down to 7 in-house patients right now. 1 on the ventilator. We haven't been down to 7 patients since May. So this is a big improvement for us. And a lot of those patients that we still have been here for 20, 30, 40, 50 days, some of them.
Yeah.
So these are patients who are quite sick, but we have not admitted new patients with COVID in several days. And so that's a good sign. We also were testing fewer in the ER, fewer in the outpatient. We've had days where we tested as many as 62 in the outpatient in one day. I think over the weekend we had a day where we tested 3. So we are seeing, and again, those are symptomatic people that that we were testing at 62. Those weren't just screens or that sort of thing. The mask ordinance is working. Back in late June, all of the hospitals in the state of Mississippi, we had a call with the governor. And at that time, the governor, Dr. Dobbs, were asking us to find any ways to increase capacity, find any ways we could expand ICUs. And we basically, through the Mississippi Hospital Association, pleaded with him, pass the mask ordinance. Help us so that we can help you. And he did in the weeks prior to after that call. And we got to say the results since that time have been shown. And as people will wear the mask, it does make a difference. And but I don't want us as a community to say, "Oh, good, it worked. We're okay. I can leave my mask at home now." This is something that, like Brad said, we don't want to do. We don't want to wear the mask, but it works. And if it gets us back to normal faster, I'll wear 2 masks. It doesn't matter to me. So,
Thank you.
Much improved.
Thank you, Lance. Thank you. We also have on the call, we have Ricky Gray, President of the Adams County Board of Supervisors. President Gray, how are you today?
I'm doing just fine, man.
Good. I'm so grateful to be working with you and the relationship that we have developed. I know you were on the call last week. You had just experienced the loss of a very dear friend of yours, and our condolences to you. And so I know if anyone's taking this seriously in our city, county, you are. Why don't you give us a report on how things are in the county today?
Well, man, I think everything is going fine in the county. Like Brad said earlier, with the city and the county and the EOC being on the same page to make all of our jobs easy. But I want to just say to the first responders and the frontline personnel, and especially the healthcare community. Without them, I don't know where we'll be. And I know how much of a burden it's been on the healthcare community because the options they have to put in. But one thing I can say, and Mayor, you said it earlier, and I said it before, once an emergency or a pandemic or whatever hit our community, you see our people pull together, work together, and try to do what's best for Natchez and Adams County. And that's the most important thing, that we continue to show that we on the same page and not panic, and let the community see that we are not panicking, then I think we're going to beat this. I know we're going to have to pray, but like I said, as long as we're on the same page and continue to communicate and cooperate with each other, we're not going to agree on everything. That's why we have these EOC meetings for everybody to voice their opinion. But at the end of the day, we come out with a united front and try to do what's best for Natchez and Adams County. Thank you, Mayor.
Oh, that's wonderful. Well, President Gray, you know, your friend, I know you're friends with Governor Tate Reeves. Saw him Monday, and he really had a compliment for us. And he said, we are an example of what a community should be. He said, communities where the city and county work together are going to be the ones that really have progress and growth in the years to come. And so I just am very grateful to you and your leadership for helping make that happen here in Adams County.
And I appreciate the relationship that me and you have developed since you've been in office. And for as the governor, you know, I always crack a joke with him because he played point guard in high school and I played point guard. And the point guard job is to make everybody on the floor happy. So we know about teamwork. And if we have teamwork, I always say teamwork makes the dream work. So we're going to continue to be on the same team, man.
Amen to that, President Gray. Teamwork makes the dream work. We are now going to go to some special guests that we have on the call. We're going to start with Sheriff Travis Patton. Sheriff Patton, I will never forget getting word and hearing that you had been diagnosed with COVID very early during this pandemic. And we were all so grateful to see you rally. And not only that, now you're being a help. I know you just dropped off documents at City Hall today to help us as we are looking into our MEMA reimbursement. So Sheriff, we're appreciative of all you've done and your officers. How are things going from a law enforcement perspective?
Mayor, thank you all for having me on, and everybody else that's on the line. I got to say, God has been good to all of us here in law enforcement and all the first responders community. As you know, we don't have a choice whether or not we respond to a call or situation or a house. And until this data started coming in, we didn't know who had what. But, at that point, it really didn't matter. All we knew is that we needed to take the precautions that we need to keep ourselves safe still while answering the call. And that has been passing over the last couple of months. But I must say that I've seen, us in these private meetings, we battled, we went back and forth on good notes, and we did everything we needed to do to move this community forward as a whole. And so I do appreciate the newfound relationship that we have working together with the city, with the first responders, with the medical community, and even the private sector as well, because there is no one entity that can combat this monster by itself. It takes a total team effort. I was listening to President Gray this morning speak about, and Ms. Lance there too as well today, speak about how we can't get lax because our numbers are going down. I can't agree with that enough. People need to make sure that they're still complying with the governor's orders, with the city and the county's ordinance as well. But just think about yourself. If you don't care about yourself enough, think about others as well to protect them, because not everybody has that good health that I had and others who combated this, and yourself as well, Mayor.
Yeah.
I know I don't want it on my conscience thinking that I gave somebody with underlying conditions COVID and it caused them to cut their life short. I'm not pointing fingers or anything like this. I'm just reminding people how serious COVID is. No matter what you see or hear on the TV, it's real. And those and our medical personnel on the ambulance services, both of them, and at the hospital, can tell you all too well the stories that they've seen in-house. So as far as us, we've had our bouts with it in-house at the sheriff's office where we don't have, at this time, we don't have any offenders that have COVID, and we don't have any staff or personnel that is out with it. When it ran its course with us, Nurse Practitioner Campbell and Mayor Health was there to help us the entire way. When we needed to be seen and get our people tested, they allowed us to come through those doors. And with us, time is of the essence on everything that we do. And so I do want you to know that I appreciate them, and I appreciate the county and EOC providing the PPE and the gear that we need, because our guys and our ladies were out there on the front line every day, right along with these medical personnel, still having to answer the calls that they're sworn to do. So right now, all is good in the community, and I'm asking the community to continue to comply with what's been put out. But I'm asking them also to continue to pray for us, because this battle is not over yet. We may have survived the first wave, but it's definitely not over. We need to keep moving forward in unity as the tone has been set at this time. Thank you.
Thank you. Thank you, Sheriff. We also have with us Police Chief Walter Armstrong. Chief Armstrong has become such a friend to me and the city of Natchez. Chief Armstrong, how are things within the police department? And I know you actually have been working with businesses and citizens throughout the city. How are we doing?
Good afternoon, everybody. This is Chief Armstrong, and thank you all for having us on this call. This is one of the things that's become the norm in the last few months, because we have had a number of calls. But what I have noticed during this pandemic, we have gone around and met a lot of business owners, and we have had our officers to take around several directives from the city in terms of guidelines of how they need to go about protecting themselves and their customers. And I must say, without a doubt, and we have taken by a ton of them, but they were well received, and we have gone back and made sure that they displayed those guidelines at their businesses, and that is the case. They have done so. So we have noticed a cooperation from our business owners. Their biggest fears was that they would be able to operate and not be having to close down, because we know that to make a living, you have to be operational and doing what needs to be done. So they certainly have worked with us. Officers have not gotten pushback from the business owner or the customer. So it's been a huge cooperation, and I think as a result of that, that is the reason we are able to report back some of the reductions that we are seeing. Now, that has not been the norm in all neighborhoods, but we have obviously done well. One of the things that we did, we made sure that they understood that we wanted to make sure that they were safe, and we wanted to make sure that their customers stayed safe so they can continue to do business with them. So it wasn't a aggressive approach on our part. And so for that reason, again, we didn't get any pushback. Now, from the standpoint of the police department and law enforcement, we have at one time had 4 at different times officers and or civilians out on sick leave, but they all recovered. So we are certainly making sure that masks are being worn and social distance is being applied to set the example that we need to set with this community and be the example of how we want to proceed with this COVID-19. But nevertheless, I cannot be more proud of what I have seen with our community and how they have responded to this COVID-19.
Thank you. Thank you so much, Chief Armstrong. Now we also have on the call Tim Houghton. Tim is with AMR, Ambulance Service, Medical Response. Tim, how are you today?
I'm doing good, Mayor, and I want to say thanks to yourself and President Gray for putting this all together and allowing us a public platform to kind of share where we are and where we intend to go in the future with things with this current threat. I want to kind of repeat what the sheriff and police chief have said first and foremost. For first responders, it's not a question of if we're going to go, it's always we're going to go. So for us, we know it's not either a question of if we're going to end up catching something like this. We know we will. And for that reason, we take the best efforts possible. And it starts with what everybody's already been saying on the call. It starts with something as simple as a face mask. And from there, you continually decontaminate, you continually try to prevent any kind of cross-contamination and spread. And in those regards, I want to praise Merit Health for their working with us early on in the process and making a safe entry point for not only the general public, but for ambulance crews that were reporting in and giving a heads up that we were coming with a patient that possibly was exhibiting signs and symptoms of COVID. They've done an excellent job with handling that and timely getting us turned around and getting us back available to take that next call. So from a healthcare market and from a healthcare perspective and public responder perspective, I think that all of our agencies have pulled together and we've done a very aggressive job at managing what's not a daily norm for us. And doing so, we've had some really good results. I'm very pleased to hear that both the Sheriff's Department and the Police Department are currently workforce free from anybody being not laid off, but on quarantine from them. And I'm proud to report that our staff and through the daily procedures that we take and protecting them as well as the general public with what we do, we're also quarantine free of all employees at this time. And that is a huge statement because I can assure you across the state and across the country there are departments from both law enforcement, fire, and EMS perspective that are having very difficult times making responses because of their staff being so limited. So I'm very pleased and very proud of the community's effort and all of our agencies' efforts in working together and making sure that all of us stay healthy and continue to serve those in our county and our city.
Tim, thank you. A good report. But we now have someone from Metro. They are another emergency responder in our community. Do a great job for us. Jim Graves, I believe you're on the call.
Yes, sir, Mayor. Thank you. I appreciate the invitation to be on the call today with all of our community leaders. I'm going to keep mine short. I just want to mirror what Lance said, and Mayor, this goes along with your policy. Everybody continue to wear a mask and practice hand sanitizing and social distancing whenever possible. Granted, I think we might survive this and just make it through it. And again, guys, I appreciate the information that's been shared today. And as always, if me or any of my staff can be of service to any of you, please let me know. And Mayor, if you'll forgive me, we just got issued a tornado warning here from Monterey. I'm going to step away from the phone and see what's going on. So, Brad, I just texted you about it. I don't know. I got it about 2 minutes ago.
Keep it over there.
Yeah.
Yeah.
Mayor, if you'll forgive me, guys, I appreciate your indulgence. I'll talk to you guys later.
You take care of yourself, Jim. Thank you.
Okay.
Thank you. We're going to see if Norma Williams can now give us a report. Norma, you've been following the statistics all the way through, and you always have real up-to-date information for us. What do you have today?
Good afternoon, everyone, and thank you. Today's metrics through today, that is, for Johns Hopkins University Medicine Coronavirus Resource Center, the Mississippi 7-day rolling average positivity rate at September 21st is 4.4% compared to the September 14th rate of 10.4%. However, I want to note that we're missing data for the entire day of June 18th, so that could have skewed that result of the 4.4 percentage rate being so low, because we've seen it happen. So, once we get a full week's worth of data, we may see it increase a little bit. Now, with respect to Adams County, over the past 7 days, September 15th through September 21st, per Mississippi Department of Health 6 p.m. reporting, Adams County had an additional 45 new cases, bringing our total to 922, or a 5% increase compared to the prior week's 49 new cases. Now, not included in these numbers are the information that they just sent today, which is 4 new cases that was reported by them. So that means we're up to 926 cases. Additionally, when comparing the impact of Labor Day and the resumption of some schools to the July holiday, the 14-day period of September 5th through September 8th totaled 97 cases, compared to the 14-day period of July 4th through July 15th, which totaled 92 cases. In a week, we'll be able to do a comparison of a 21-day impact to holidays to see how we're doing. Also, we received today the report from Mississippi Department of Health for the K-12 schools. As of September 18th, Adams County has reported a total of 2 students and 1 teacher staff testing positive, with thankfully no reported absences. Additionally, for the week ending September 18th, there are 3 teachers/staff and 3 students that are quarantined, compared to last week of 1 teacher, staff, and 5 students. That was for the week ending September 11th, comparing it to this week ending September 18th. And so we've increased a little bit. Now, looking at the weekly year-to-date quarantine high, we had 5 teachers, staff, and 26 students. That was set for the weeks ending September 4th and August 28th, respectively. So thankfully, we haven't gone back up to those numbers. So, do y'all have any questions about the Adams County or the Concordia Parish numbers, or if you need anything for Mississippi or Louisiana? I'll be glad to try to answer your question.
Thank you. Thank you, Norma. I tell you what, we have had some good reports today. I am encouraged, and Mr. Bradford, it goes back to what you said at the beginning. We're working together to get this message out. If people will just do the right thing, we can see a continuation of a better situation than we were facing earlier. I believe we have members of the media on the call, and we are now going to open it up to you for questions of any of us here or any of our guests on the call.
Hi, this is Margaret Perkins with Listen Up Y'all Media. Yeah, actually, I just really wanted to say thank you for putting this together and having so many resources and folks at the table today. I really don't have any questions. I just want to thank everybody for the update. Sounds like we're at least making some progress, and we will certainly continue to push our mask and washing hands and doing this, and take a little bit of some of the statements that each of you have said about working together. This is going to be around for a while, and I don't know what you guys are even thinking about. A 90-day, 6-month deal at this point. I was talking to some friends earlier today. So I don't know if anybody can speak to that, what kind of time frame you're even looking at, or if anybody would even venture to guess on that. And that's the only question I've got. Thank you.
Mr. Bradford, have you been given any idea of how long this might continue?
Well, what we're doing now, I know Mima, we're stacking up on supplies.
Yes.
But where we're getting, I know a lot of people, if we continue to wear the mask, I know everybody's concerned about the flu season. But I think what they're trying to say is if we practice safe distancing, wearing our masks and stuff like that, it may not hit us as bad. But we're anticipating the flu season along with COVID, because I know a lot of them are fearing if you get both at the same time. I guess that's what they're trying to look at. So our focus on is stacking up, because like I say, kids are in school and they're gonna come home and stuff back to their neighborhood. So we're looking at that, making sure we have enough supplies, and if we get a second wave, we'll be able to sustain our local communities with either face masks or hand sanitizer. So we have been stacking up on it. But as far as a timeline, like I say, it depends on the individual. Like you said, if we stay the course, wear our masks, we can get through this. But if we recess, it just starts the process all over again.
Yes, we don't know. I don't think any one of us has a crystal ball. We're hearing things about vaccines. We don't know. But I do know this. There are communities across our nation that have opened up very irresponsibly, have not worked together, have also shunned the mask, and some of these communities are now closed again, and their economies are suffering. And thank goodness that's not Natchez Adams County. Thank you, Margaret. Anyone else want to respond to her question? Scott Hawkins, is that you?
Yeah.
You got the floor.
Great. Brad, can you give us an update on the active cases in the county?
Oh, right now we're at 85. And like I say, within that 85, you have some at the hospital and some also in the prison system out there. So, we're doing great. We normally was around 100. So we're flattening, we're going down. Just keep in mind, like I said, those numbers are coming from Labor Day and schools and stuff like that. So right now we're tracking the 85.
Well, this is Margaret Perkins again, quick question, Listen Up Y'all Media. Mr. Bradford, I believe that you spoke once before about trying to, I think you were speaking to someone at the state level, maybe even the governor, about trying to split the caseload. Like if you have 85 cases, you said you had some in hospitals and some here, but you also had said some in the prison system. Were you able to accomplish that, to separate that data?
No, because it's going to be hard to track that, because they go by your residence. The reason they do that is, even though you may have a Mississippi Adams County licensed residence and you get tested somewhere else, that number comes to us. So it's a tracking mechanism to see where that individual is at that time, because the state have to go through their contact tracing to try to see where everybody at and stuff like that. So it was hard for us to get them to break that data down. So we just have to do our best as far as knowing who's in isolation and who's out in the general public. The ones in isolation and containment, we know they can't spread because they're locked down. It's the ones in general public, the ones that we trying to focus on right now. Not saying that, they're not important but the ones that's out in the public that don't know they got it or they have it and not quarantining, that's what we're trying to focus on.
We're coming then to the conclusion of this. I would like to repeat what my friend Ricky Gray said a minute ago, and that is teamwork makes the dream work. We are always hearing feedback, and I know people get upset about it, having to wear the mask. But Lance, is significant to point out that things are so much better right now than they were prior to the mask ordinance. And we understand also that every expert across the medical community, the ones that we know and trust, have said that it's as simple as this. If you don't think the mask is effective, then why don't you insist that they remove the mask next time you go in for surgery? Or when your wife happens to be delivering a child, why don't you insist that the neonatal nurse, the doctor, and everyone in there remove their masks? I can't think of anyone in America that would want that.
Exactly.
And so it just shows that the evidence is there. We've been following it for years, that even when you go into the dental office, they're wearing masks. And this is pre-pandemic. Mm-hmm. And so we know that the medical experts are right, and I'm going to follow them, and I'm not going to follow anyone with a Facebook medical degree. I know we have a lot of Facebook doctors out there, but the real doctors tell us to wear the mask, and I'm wearing mine, and that is the simple message. It's a simple ask. Wear the mask. We will get through this, but I'm very grateful that we've had this time together. We want to encourage everyone that our economy's open, and it's because we're working together. We're doing the right thing. President Ricky Gray, are you still on the line?
Yes, Mr. Mayor.
I'd like for you to give us the last word today.
Well, the last word, everybody keep repeating. As long as we continue to wear our masks, social distance, and wash our hands and sanitize, then it's a win-win for Natchez Adams County. It's a win-win for our citizens and our business people.
Amen to that. Thank you, everyone. God bless you. And thank you for listening and tuning in to COVIDCurrent.